We all have trauma, but we don't have to call it trauma. We could call it emotional injury. We could call it moral injury, ego injury. If it changes the way we perceive ourselves, we perceive the world, or has a negative impact on our viewpoint, it is a type of trauma. It has left its mark on you as a person, both physically, mentally, emotionally, and maybe even spiritually. So what is emotional injury? It's a lasting emotional impact from a circumstance or something that happens. So I lost my biological father when I was 10 months old. He died in a car accident. He just never came home. And I have told myself my whole life that that is not trauma. That is, not even grief, because I don't remember him, so I can't grieve losing him. But it created an emotional injury. I wanted him to come home. I expected him to come home. He was in my life and then out of my life. That created an emotional injury. What about the little things that people say? I currently, or have always kind of struggled with, like, I'm fat, I'm not smart. I can remember the first time someone insinuated that I was fat, or the first time someone insinuated that I wasn't smart, right? These are micro injuries or emotional injuries that happen throughout our life. Any kind of, I want you to stop and think for a second in your life, any loss, betrayal, someone coming in and out of your life, any kind of instability in your childhood, or even in your adulthood, causes emotional injury. Divorce, right? We've got the grief and the emotional injury that happens there. What about moral injury? This is when your values are put to the test or your values are deeply violated. So I'm a nurse, and I remember being trained in triage. And when you're working in an emergency room, you have to triage, or if you're in ICU and there's only one ventilator and there's 3 patients that could utilize the ventilator, who do you think gets the ventilator? The person that gets the ventilator is the person who is most likely to survive this event. It's not the person who needs it the most. And so that could cause a moral injury for a nurse, a doctor, healthcare worker, maybe even the family that is around during that. What about soldiers? Soldiers are going to war for our country. And maybe they don't really believe that the intent of the war, right? Or the purpose of the war. So there's a moral injury there. They're defending their country, and they're proud of that. But maybe part of them doesn't agree with the decisions of going to war. Or what about in the midst of a firefight? So many soldiers I have talked to, as they're going through treatment for their PTSD, they will tell me, I had to kill a child or me and my team were going to be dead. That is moral injury. We as humans don't want to kill anyone, let alone a child. That is moral injury. What is ego injury? It's a blow to who you are. I can give you a perfect example with me, and I have lost 3 children over the course of 20 years, and both of my biological children. And there's times when I feel like, am I even a mother? Right? My identity was being a mother. And so that is an ego injury on top of the grief and trauma that I'll share later. So whether it's micro injuries or big T trauma, it all hurts. So You might have heard the terminology microtraumas. I like the word injury better, just personally, because we all have injury and we can all acknowledge that we have injury. Sometimes it's really hard to say, I have trauma, right? But if we define it as injury and trauma has an impact on your mental, physical, emotional health, then we can say that it is universal, but it is also very personal. My name is Dr. B. I'm a psychiatric nurse practitioner. I've created what we call the Mentally Strong Method, and I have been through some pretty serious grief and trauma. I've lost 3 children and my husband over the course of 20 years. The first, Johnny, in a drowning accident, he was there 1 minute, lively and happy, and gone the next. My son Reggie had 10 years of what I now know is medical trauma. I didn't identify it as that going through it. And then my daughter dies in her sleep of sudden unexpected death and epilepsy. And her death was traumatic. The day I found her was trauma burning into me. Still, after losing 3 children, and I'm a psychiatric nurse practitioner, 25 years of experience, I told myself I don't have trauma. I have grief. I'm a grief specialist. I'm going to teach people how to grieve. And I did acknowledge some spiritual conflict, right? Like, how could a God that loves me allow these horrible things to happen to me? But I didn't identify it as trauma until I got hard evidence. I went for a brain scan and my amygdala was on fire. That's exactly what the doctor said when she looked at the scan. She said, your amygdala is on fire. Now, I'm a nurse. I know what the amygdala is. It's the fear center of the brain. And it was on fire. She said, this is not a brain of grief. This is a brain of trauma. And when I saw it objectively, I could not deny the trauma. And as I verbalized it, as I admitted, then I was able to release the trauma and, cherish the grief. And I talk about that a lot. But many people do this. I have helped so many people that say, I don't really have much in my life, but I'm depressed, I'm anxious, I don't understand why. Now, there's biochemical reasons why and things like that, but identifying those emotional, moral, and ego injuries so that we can see how they are impacting your current life is going to make you happier and healthier. So many of us are doing resilience by just pure grit. Denying injury doesn't erase it. So my example of saying, I don't have any trauma. Denying that does not give me the opportunity to let it go, right? It was enmeshed with my grief, and I'm not going to let the grief of my children go. And I have videos about that, right? But the trauma, I was holding on to the trauma as well. So denying it does not erase it. So step number 1, understand the definition of trauma from a mental illness standpoint, right? So a psychologist would say it is an emotional response to a terrible event, okay? So, again, many of you are saying, well, I didn't have a terrible event. I had a decent childhood or, these things. But again, psychology and psychiatry is defining this as it relates to mental illness, not as it relates to a whole healthy body, moving towards mental strength. Psychiatrists in the DSM, as far as post-traumatic stress disorder, defines it as a life-threatening, violent event, right? So again, this is in the context of mental illness, which I do treat. But I also treat and help people understand that you don't have to meet criteria for PTSD for your trauma to be impacting you. So what does research say? Research says that it's not about the event that you experienced. It's actually about what it does inside of you. Trauma reshapes the brain. Remember I was telling you about my scan and I said, the doctor said your amygdala is on fire? It reshapes your brain. So the amygdala becomes on high alert, right? So the on fire was a metaphor, but it was, my amygdala was dark red. It was bigger than it should have been. I was in chronic fight or flight. My amygdala, actual chemical reshaping from my trauma was making my amygdala on high alert. The hippocampus struggles to place the past in the past, right? So the hippocampus is kind of the filtering and, we can live in the present moment. And when you have trauma that has reshaped, now we're going to talk about whether it's trauma or injury, it has reshaped the hippocampus and how it responds, and it has a really hard time staying in the present moment. The prefrontal cortex, this is your executive center of the brain. This is where your attention, your focus, all of that stuff happens. And when your amygdala is on high alert and your hippocampus can't keep the past in the past, all of that energy is coming down instead of going up. And so then you begin to lose control of your fear responses. And so in extreme cases, you have that PTSD response. But what about just the average, everyday, stressed out person who is having trouble controlling their anxiety? That is your prefrontal cortex not being able to take control of that fear because the amygdala is overworking and because the hippocampus is not able to keep the past in the past. And your body will react. We often separate mental health and physical health, but they are all integrated, right? The more mentally healthy we are, the more we can take care of our physical body, and those things will not sit and resonate in our body. So, pain in the stomach, gut issues, insomnia, these are common. And even, Western medicine will agree that those things can be related to stress. So number 2. So remember, step 1 is understanding the definition of trauma, which may, mean mental illness, but doesn't mean that you don't have injury that's impacting your brain and your body. So step 2 is identifying injuries as microtraumas. These are little things that have impacted you over the years, and they are impacting your physical, emotional, mental health. Okay? And so just identifying them, sometimes it's easy to just let them go, right? I want to talk a little bit about other healing traditions. So Western medicine, kind of keeps these physical and mental separate. We've got a lot of research that says differently, but as far as you go to your practicing primary care or psychiatrist, unless they're an integrative or holistic psychiatrist, they're probably not talking about these things. But in Chinese medicine, they actually discuss and believe that different emotions are held in different organs. So your grief is held in your lungs. And this has been very true for me. I have had trouble taking deep breaths as I learn to grieve, right? I've done lots of breathing exercise to try to work through the heaviness of grief sitting on my chest. Fear is held in the kidneys in this Chinese medicine, right? And anger is held in the liver. So they do a lot of treatments around releasing some of these emotional things rather than just focusing on the symptoms that are happening. Ayurvedic medicine is the same. The Ayurvedic medicine is another Eastern type medicine, mostly coming from, Asian, Indian population. But they believe that trauma, including microtraumas, disturb the doshas, right? So for example, if someone had gotten into a car accident and they said, I'm physically fine, I'm mentally fine, I'm not scared, everything's fine, but I'm going to go to my Ayurvedic practitioner because my gut is starting to, like, I'm getting indigestion and I'm getting some heartburn and I don't know where that's coming from. And the Ayurvedic doctor would likely say that it is from your car accident, right? You disturbed some balance in your body. Energy practitioners do this. Reiki, body talk, quantum physics practitioners, like they talk about the injuries that have happened in your body. They disrupt the flow of the natural energy. And so part of their treatment protocols are moving that energy, recreating the balance so that you can be physically healthy. So Western medicine doesn't, really talk about that too much, but we do know that chronic stress, all of the research says that chronic stress hurts your health. So whether you call it stress or you call it energy, these emotions are impacting you on a physical level. Acknowledging injury does not mean reliving the pain. I have many high-functioning people who are like, I'm not opening those boxes from my childhood. I've worked through that. I've done the work, and I am now a very successful person. I'm not asking you to do that. You do not have to relive the pain. But what I do is teach you how to think, organize, and choose. So if you take a moment and download the worksheet in the description, it's my Think, Organize, and Choose worksheet. It's like the first step in the Mentally Strong method. Can you think through your problems now in the current? I'm not saying your problems from the past. In the current, can you think through your problems, organize them, and make choices in line with what you want? So, if you're working with me, I would actually do a thought map. And in the thought map, let's say you're dealing with anxiety and you're like, I'm just chronically stressed because my kids are in 3 sports, I'm driving around all the time and I am just overwhelmed. Okay? So let's map overwhelmed. What makes you feel like that right now? You could easily identify all those things. But then I'm going to continue to ask questions. And one of those questions is, when is the first time you felt like this, or did you feel like this in your childhood? And I can guarantee you there's a moment in time where you were overwhelmed with anxiety as a child. And then you begin to make the connection so that you can feel empowered, right? If you can think through, if you're just overwhelmed, and you don't know why, that just feeds into the overwhelm. But if you can take the time and think efficiently, then you will, be able to manage the overwhelm better, right? When we talked about the, amygdala, hippocampus, and prefrontal cortex, right? The prefrontal cortex is what helps you manage your current stress. But if your amygdala is overactive and your hippocampus is still making these connections from the past, it's impacting your overwhelm right now. So, going through that process of acknowledging the injuries of your past as it relates to the current moment helps. It's easier to snip it away. Okay? So, the Mentally Strong method works in the present moment. The worksheet below is kind of that first step of thinking through your problems, organizing them, and making choices in line with what you want. Look at your thoughts and feelings today. What are you struggling with? It's not about, all these things happened in my past. What are you struggling with today? And yes, we'll ask that past question, but it's more so that you can let those things go. and work through both grief and trauma. And we talk about a lot of that. Trace things back gently. You don't have to, I worked with someone recently that was talking about, all this trauma from their childhood. And I don't want to open that box. I've moved past it. I made decisions to move past it, right? That's cognitive behavioral therapy. I'm going to change my mood, and I'm going to let those things go. But the reality is, after going through, several activities, we realized that, boy, these things were impacting today. And it was easier to release just acknowledging the emotional injuries, the moral injuries, and so forth. You get to decide what to unpack and when. So when we go through the Mentally Strong method, it is not, trauma therapy, right? It is, okay, these are my trauma boxes, right? And I'm ready to open this box or I'm not ready to open this box. But acknowledging that that box is impacting you today, and then, deciding later to actually open that box is still a healthy choice. You can also easily decide what can I easily release, right? I talked earlier about people insinuating that I wasn't smart back when I was in elementary school. And I realize now I have ADD. I'm actually super emotionally intelligent and intuitive. I don't read paragraphs and answer questions about those paragraphs well at all. And that's all of your, kind of formal education. And so I thought I wasn't smart because I had this one deficit, right? So if something comes up and I, kind of get triggered to, oh, I'm not smart enough, I can easily release that because I know that I'm smart in so many other areas, and it really has to do with reading comprehension. So we all have injury. It doesn't matter what you call it. It doesn't matter if you call it micro traumas or, big T, little t traumas or, injury. We all have things from our past that we're holding on to. We're pulling it with us and it's weighing us down. It's what you do with it. It's the insight that you gain from identifying these things. So remember to download the Think, Organize, and Choose. You'll get invited to several things, but I'm going to also go into a Q&A. The first question is, do I still have trauma if I don't remember anything bad happening to me? You don't have to remember for your body to remember injuries and traumas. Many strong people think my childhood was fine. I don't have, injury or things like that happening in my life. But if you are currently trying to be the best version of yourself and you're thinking through a thought and you ask yourself questions about your past as it relates to that thought, you will realize, even if it's subtle, about, my mom didn't confidently tell me what a good person I was or something like that. It could be minor injuries, but if you have any negative thought pattern, you have some injury. So the solution is, in the present moment, look for cues that reveal old injuries. So if you're anxious about something, if you are depressed, you feel overwhelmed, map that backwards and see where that started. It allows you to move forward more quickly. Question number 2, what is the difference between emotional injury and trauma? Trauma is the storm, the thing that is happening. Injury is the mark that it makes on you. Whether, you hold it in your heart. We talked about Chinese medicine of in the different organs, the mark that it makes on your mental or physical health, that is the injury. My loss changed how I love and safety and how I feel safe, right? Like losing 3 children and my husband changes the way I perceive the world. And I'm trying my best to release the trauma and hold on to the grief and be proud and be resilient. But I cannot deny that it impacts me. But I can focus on how to release the injury part and show up today for myself first and for others. Last question. If I admit I have trauma, do I have to open old wounds? Healing doesn't mean opening old wounds or those boxes that you've put your history in. People often fear talking about their trauma or their injuries or things that happened to them in the past. You don't have to verbally talk about it to process it. But what you do need to do is you need to acknowledge the impact that it's having on your life right now and make decisions of how do I decrease that impact. Thank you so much for watching. I want you to continue watching how you separate grief and trauma. Obviously, with my story of losing 3 children and my husband, that is all enmeshed with grief and trauma. And if you are dealing with trauma and grief, you do have to process them separately. So I want you to continue by watching this video. Also remember to download the worksheet. You will be invited to get a free copy of my book, to watch my documentary, to engage in social media and some of the services that I provide. I do believe that we are all mentally strong.